thank you all for staying for this slot. I suppose we're all here because we're driven about change from the mental health point of view. And I suppose my role feels at this moment to kind of complement some of the challenges from Phil, some of the positive from Phoebe, and then maybe to just ground it in what we see in terms of young people's experience. So there are three things that I just want to cover. So just that reminder of kind of that true picture of the scale of need that we're looking to face. So I don't think we can in any way be complacent. Just kind of how I would see that we're welcoming many of those changes, but more importantly, how I think we must now move beyond a kind of treatment approach much more into early intervention. And all being well, have a film to finish on. Oh, sorry. So we're now seeing 1 in 8 young people with a diagnosable mental health need. And just picture that. That means in every classroom around England, there are 3 of those children who are living their life and with their family coping with a diagnosable mental health need. And what we know is that in addition, there's a further 1 in 6 who are experiencing some form of mental health need, such as emotional distress. And of course, the factors behind it are incredibly complex. And some of that, the kind of what the prevalence numbers have shown, is that we can celebrate to some extent we're seeing a greater degree of openness by some of the work that's been done to tackle stigma. But I do think in reality, young people are facing unprecedented challenges. And I think around when I grew up, the amount of exams that I went through, now the amount of pressure that young people face in terms of the consistent and regular exams. But we also hear from them about body image pressures, difficult family relationships, and traumatic experiences. And just, of course, all of that, which they're doing living with in an always-on digital world. And what that's meaning is that this is creating huge demand on our services. So what we've seen is that CAMHS referrals have gone up significantly in the last few years. But I think the real crisis that we're facing is actually about accessing support, not just the numbers, but how we make sure those young people are able to access support they so desperately need. Because what we know is that the average waiting time to start treatment is over 3 months, with many young people experiencing far longer. And the reality, a quarter of those referrals are being turned away because they're not able to meet the threshold to provide that support. And so at the moment, whilst we've seen great progress in terms of aiming to beating the targets for this year, the NHS is only able to support 1/3 of those young people with a need. And what we hear so often is from parents and young people that they're just being told they're not ill enough to get the support. And what we know is that they're just left to cope on their own. And so, for example, there's a young woman we work with who was referred to mental health services but had to wait months for an assessment. And during that time, she started self-harming, became suicidal, and she ended up going to an A&E and then was admitted to inpatient unit for a year. And she is very, very clear that if she'd got that support earlier, it would have been life-changing for her. But that said, we do see that there are some really positive from the ambitions of the long-term plan. And personally, it feels really long overdue we're seeing that investment into young people's needs. So there are great ambitions to increase the number of young people that we're supporting and looking to trial the 4 weeks waiting time across the trailblazing sites. But also how wonderful to see that ambition to reach 100% of young people who need specialist care within a decade. Clearly, it's an ambition that we all want to see met, and we have to obviously kind of see some of the models that will come out to meet that. But what's vital, we've heard about the need for appropriate crisis care, and both Phil and Phoebe have described some of that. And we've got to see those new models being extended in terms of community crisis care. Because what we know is that attendance at A&E by under 18-year-olds for psychiatric conditions has tripled in the last decade. And what we hear from young people is they feel that's their only option, and it's really not the best thing to help them. And one of our activists, Jenny, shared her story, and she's happy for me to share it, of why this has to change. So her mental health issues became very serious when she was around 17. And one night she realised she couldn't take it anymore and told her mum she was scared she would do something really serious unless she went and got treatment. They waited for 6 hours in A&E, before being assessed and told they couldn't do anything immediately. So she was given a referral to CAMHS, but in the meantime given a crisis number if ever she felt suicidal again. And very sadly, the next night she did, and she tried to use that number and realised because she'd written it down on her hand, she'd got the number wrong. So she then spent the time desperately trying to search online to find what that number was and where she could go. But she felt so desperate and so distressed that she felt her only option was to go back to hospital, only to be told that she shouldn't keep going back because it was a hospital for physically ill patients, and she was not one of them. And she says it took an enormous amount of strength for her and will, as she described it, that she shouldn't have had to fight so hard to stay alive. Her symptoms should have been taken just as seriously as any physical emergency. And what she says to us is, my only hope in a few years' time, teenagers and young people who are as ill as I will get the support and assessed quickly. But currently, I'm not surprised some don't make it because I nearly didn't. And I think we do know that there's a real passion and amazing commitment in terms of workforce and people there to look after young people. But we're hearing too often there are stories where young people's mental health just isn't being seen as serious as some of their physical needs. So what we're looking with some of the changes in terms of also now a comprehensive 0 to 25 model is a really promising change, and that we've got to make sure that we are cracking that transition from CAMHS to AMS and making sure that it's very much based on young people's need. Because we know it's a time of real difficulty for young people, whether that's leaving school, starting work, maybe moving an area to university. And what we know is about a third of those young people kind of just disappear when they're moving between those two resources. So what we've seen is a real commitment to trying to develop something that's from a very youth-centric point of view and creating flexibility that allows us to provide much more consistent support for young people as they grow older and making sure that it really isn't a blunt cut-off point for them. And of course, we've got to be investing in support for young people, and we've really welcomed that commitment. And I suppose when we know that half of all mental health problems manifest by 14 and 75 by the age of 24, this investment makes sense and benefit for all ages. But it's also essential that that money reaches those services, and that we've done freedom of information requests in the past that showed that not all of that CCG and local authority investment was being spent on young people's mental health needs through the Future in Minds. And in some of those areas, that extra money was in fact being spent on other priorities outside of young people's needs. But fortunately, this is something that we've been able to raise, and we've had so many assurances that that won't be the case. And that's really got to happen, that that money does go to those young people in need. And what we've also seen is a real commitment to working alongside young people and making sure that some of those new provisions are co-produced, are absolutely reflecting young people's needs. So we do see and really appreciate the real commitment to improving access and quality of support. But whilst the targets in the long-term plan are welcomed, we know they can't just rely on the NHS to meet that need, because that scale is just growing, and that crisis in terms of young people needing help. I think we're depending on a system that will never be able to cope with that capacity. So I think we've got to be looking to developing a much more comprehensive approach to early intervention. And we know that there's over 500,000 young people with emerging mental health needs who will never meet that threshold and at real risk of being left until things escalate. So recently we've seen the really tragic numbers from the ONS about the rise in suicide amongst young people, and particularly amongst young women. But we also know that those who do take their life, only 1 in 4 of them have actually been in contact with mental health services. So we must do more earlier. And so that role is very much part of our schools. So we've seen some really positive work from the Green Paper. And we don't expect them to be mental health services, but they can play a really key part in terms of building resilience of young people. And we're going to see more in terms of mental health being part of the relationship and sex education and health education curriculum. But those models are only going to reach 1/4 of the schools across England. And we have to see the evidence that shows so strongly that taking a whole school approach, thinking about support for teachers, the policies that are looking after the well-being of young people, are also those that can really impact in terms of behaviour, reducing bullying and attainment. And we've seen on surveys from people like Girl Guides, Children's Society and our own, that young people identify pressure to do it at school as one of the most significant factors affecting their mental health. So whilst it's good news that we're absolutely putting that support into school, we need to make sure that wellbeing is as much an importance to our education system as the exam results. But I also feel very strongly that we've got to be looking to our communities for those young people who aren't at school age, who are excluded, or it's not the right place. And we've seen the Children's Commissioner's investigation has shown that the majority of local authorities have actually had to cut their early intervention support, such as school nurses and council and community provision. And many of the young people we work with know that they could have identified several adults who, if they'd just been trained and able to support them earlier, could have made a really significant difference. So how do we look at the role for trusted adults such as youth workers and sports coaches that young people themselves tell us they could see could play a role? And we've seen some really positive adoptions in places like Birmingham with Forward Thinking and the Hive in Camden. They're adopting some of the practice where we've learnt from Australia and Canada about how you can create very much community-based, youth-centric services. And I think we've got to start thinking about those models for the UK. Also important is how do we think about all those professionals who are working with children in terms of understanding and supporting their mental health, but particularly for the need to understand and be trained from a trauma-informed point of view, so that they can start to identify and see that some of the behaviours are an indication of something that might be going on in their life, rather than necessarily something that either needs to be disciplined or removing them from a situation. And of course, there's a greater opportunity for collaboration between agencies, and we've touched on this in terms of how do we make sure that charities are playing a really key important part, and making sure that we're seeing pathways for young people to be moved from appropriate services and helped. And I think we've seen some great work around the long-term plan of working with charities to bring that expertise. And there's a real ambition to how do we make sure that more of us are directly involved. Because I think we are in it together. We have to be looking at that opportunity for bigger change that we can do by greater collaboration. But also the value of technology to reach young people. What we know is it can be there to help those who are at that midnight moment, for those who might be in geographies where they're not able to get out to get support. And how do we also make sure that we're providing, using the data, to make sure that we're able to surface really good provision that's happening in people's communities. So we hear a lot about social prescribing, and for me, the heart of that is being able to have the data to know what is available, whether you're a GP, whether you're a parent or a young person, to know what is available for me. And at the moment, we've got some great directories, but honestly, if you put your address in and what you need, you're often coming back with 10 pages. And it's really hard when you're in need to work out which of those are going to be right. So we have to be looking, both within that social prescribing, to really effective use of data and technology to make sure that we can be surfing great provision in a community that young people may otherwise not know about. And finally, one of the things that we feel very strongly about is that we have to start looking for a much more cross-government approach in order to tackle some of these things. Difficult at this time, I know, but we're really trying to keep some focus onto this and how we ensure that ministers are looking at the kind of factors that make mental health worse, but also making sure that their policies themselves don't have an inadvertent negative impact. And I suppose just at the heart of what we've been doing is our Act Early campaign. So the things I've been talking about, we've co-created with young people and created a film and a campaign where they've wanted to call for change to happen. And so far, through the work we've done with them, we've had over 50,000 people signing our petition. So of course it'd be great if you do it, but it just felt a nice way to end on something that young people have created with us.
Mental health problems don't start when you're in A&E.
They don't start when you're stuck on a waiting list. Or when your GP tells you you're not ill enough.
Or when your teacher tells you you're disruptive.
Mental health problems aren't just about social media. Or just about exams.
Or just about local youth clubs closing down.
Or things going on in your family you feel you can't talk about.
Mental health is about everything that happens to us. Of course we need more money for the NHS.
And more support in schools.
But we also need action across society.
Across government.
To look after young people's mental health.
And make sure everyone gets the help that they need.
As soon as they need it.